Welcome back. This section of the show is called Ask FPA. Gives you the opportunity to send your questions to tv@fpalex.com and include your name if you would like us to use it on the air. Tonight's question, asked by Shauna Carter from Lexington, Kentucky, is what is vasovagal syncope? And here to help me answer that is one of my partners at Family Practice Associates, Todd Martin, who is a nurse practitioner, predominantly at the Harrisburg Road location for Family Practice. Welcome.
Thank you.
All right, now to use a big word, vasovagal syncope, and I started at the beginning of the show talking about fainting. Is it the same thing, or tell us what vasovagal syncope is?
Well, essentially it's the same thing. So the definition of vasovagal syncope or syncope of any kind is a transient loss of consciousness, usually lasting 8 to 10 seconds, and typically they fully recover afterwards.
What brings it on? What causes it?
There's a number of things that can bring on syncope, such as a sudden loss in your blood pressure. You'll see that in elderly patients, sometimes when we adjust their medications, being very nervous about being on TV. Having your blood drawn at the office, that's a real common frequency. Patients get just nervous about getting blood drawn and they'll lose consciousness for a few seconds. Typically when they regain consciousness, some people will have little memory of what happened. They'll be confused for a few seconds, but typically they fully recover back to their normal state within minutes.
And this is usually a short term event. It's not likely you're passed out for, it's usually seconds to minute, not hours or
that is correct.
Or days.
You get certainly worried if somebody's passed out for more than just a few seconds.
Well, is it something to worry about when somebody passes out?
Always, when somebody loses consciousness, that is of concern because you have to ask yourself what caused it. There are many causes for syncopal episodes or losing consciousness, such as cardiac arrhythmias can cause that. Intoxication can cause it. Losing your blood pressure. Sometimes you'll see it with athletes that have certain heart conditions that aren't diagnosed.
So if somebody passes out, what should they see the doctor? And if they do, what can they expect the medical workup to be?
Yeah. So I think a good rule of thumb is always when do you call an ambulance or when do you go to the hospital versus when do you call your doctor. If it's in the history is a really big part of kind of what were they doing when this happened. Did they just standing there being normal and all of a sudden collapse? That's more worrisome than, I'm getting my blood drawn and I pass out, or I go from a seated position to a standing position and then I pass out. I think the good rule of thumb is anybody who loses consciousness should be evaluated by a medical professional. Any loss of consciousness more than a few seconds should absolutely be evaluated in the emergency room. And if they're out for minutes, you should call 911 immediately and get them evaluated to make sure that there's nothing going on more serious than they just passed out. If they regain consciousness quickly, certainly you can, and if they within a few minutes seem like their normal self, I would certainly call our office or your doctor's office and schedule an appointment to be evaluated because we still need to determine the underlying cause.
So passing out from blood drawn, you're right back up, nothing to worry about. Passing out from a cardiac arrhythmia could be fatal, and it's a good idea to get evaluated for that.
That's correct.
All right. Now before I let you go, we're right in the middle of flu season. Tell me about what are the symptoms that you think you might have the flu and what do you ought to do about it?
So yeah, we're knee deep in flu season right now. So typical symptoms: high fever, greater than 101, body aches, chills. They just feel terrible. And when you walk in to see these patients, you can typically tell because they just look like they feel terrible. Typically you want to get evaluated within the first 72 hours of symptoms because that's kind of the standard when we prescribe Tamiflu, which is an antiviral agent to treat the flu. And if you wait a week, it's really going to run its course at that point.
And the flu is different than just the common cold.
That is, the flu is totally different than the common cold, different virus. And the flu is, I believe, the #1 fatal infectious disease worldwide. There's already been several deaths in Lexington. I saw that this morning, attributed to the flu. Mostly affects the really high-risk patients pediatric patients and the elderly or people with multiple health problems like COPD or lung problems like that.
It's not too late to get the flu shot?
It's not too late to get the flu shot. We have them available.
All right. Thanks. Great information. We'll be right back.